My dad was an immigrant, and he came over at the age of 7, and they lived on the Lower East Side in a cold water flat. And my grandmother decided, lined the 3 boys up and said, education is the only way out of this. You're going to be a doctor, you're going to be a dentist, and you're going to be a lawyer. The lawyer became Chief Justice of the Second Circuit Court of Appeals and tried the Rosenberg some years ago, and my dad became a doctor. And it left him and my mother nuts about education, and they felt very strongly. When I was a kid, I was supposed to go to a junior. Dad set up practice in an area which was sort of a downscale area in Brooklyn. And I was supposed to go to a junior high school where the students shot at the teachers and the teachers threw chairs at the students, and it was not a nice place. And my mother decided this was not for her little boy. And so I applied to private schools. The first was a school called Lawrenceville, and I was informed that their Hebrew quota had been filled, and I was no longer eligible. But finally I went to another called Petty, and my dad believed in work, and he said he would pay our obligatory expenses, but if we wanted any spending money, we had to earn it. So we worked. Every time we had a vacation and stuff, I was a house painter, a waiter, a lifeguard, you know, whatever. One summer, I talked to a prominent doctor, and I was trying to get him to give me a recommendation for medical school. But instead, he said he worked at the Harvard School of Public Health, which was a postgraduate school with all the high, very educated people. And I had a year of general biology. I didn't know anything about medicine. He worked with me for 2 weeks and he took off. And he left me in charge of the main cardiovascular lab, several $100,000 worth of equipment, 2 40-year-old laboratory assistants to boss around, and an unlimited budget. And you know, I was a kid. It's crazy. But it went well. We published a couple of papers, the lab went well. The high-powered doctors were nice to me. And it's interesting that many of them were working on making iron lungs so that kids paralyzed by polio could lie there in this lung, and if the machine stopped breathing, they would die. After I went to medical school, and after that I took my internship at the Mass General, and it was wonderful. But one night in the emergency room, for example, I had a 45-year-old trucker come in with chest pain, and while I was at medical school, no particular patient, I was still learning to be an intern. He got a cardiac arrest and died. And without thinking, I grabbed a scalpel, just out of medical school, sliced open his chest, stuck my hand in his chest, and started to squeeze his heart. And in the middle of this, he woke up and he said, "Doc, it hurts." Can you imagine? And then finally, people who knew what they're doing came, but he left the hospital.
Wow. Oh my word.
I went to the NIH, and a project I had planned to do was already taken. So I ended up working with this parasite called toxoplasmosis, and I learned that I could grow it in tissue culture. And it was like a virus in the sense that it had to be inside a cell to multiply, but it was big enough so you could see it. And so you could put drugs and test it and do all kinds of things. So as someone who had just finished his internship with no training in parasitology, I became the world's expert in parasitology. And for several years wrote the major chapters in the textbook. I was an intern in ophthalmology. I mean, a weird life. It went well, and while I was at the NIH, the guys from the University of Florida found out about my work, and they asked me to be head of the Department of Ophthalmology. And as mentioned, I told them they'd have to wait for 3 years while I learned how to be a doctor. They said that was okay. And so, in a sense, I started at the top as a professor. And, but I was totally unscrupulous. I brought to my residency a research grant based on what I'd done, and when a place accepts a grant, they're supposed to guarantee that you got space to work. Well, I knew they would never do that. However, I was just a kid and they were so disorganized. So I showed up for my first day of internship with a whole truckload of toxoplasma infected animals. And they found me space in a condemned building that was soon to be torn down. And I had this crazy idea that there were hundreds of labs with brilliant people around the world trying to treat virus disease. And I thought they were all working in the wrong way. They were working at the wrong biochemical site. And I found a drug which had been made for cancer some years ago and wasn't so good that worked on this site. And decided that I was going to be the first one in the world to cure virus disease. Well, this drug was not very soluble, so you had to treat them both during the day and at night. And I needed help in the lab. I mean, you know, I was trying to learn how to fit glasses and take out cataracts and do all the stuff at the same time. But fortunately, prejudice cuts both ways. And there was a brilliant woman who was a chemical engineer at Northeastern, the only woman in her class. And she finished and she couldn't get a job in chemical engineering because she was a woman. And so she had to come work with me. And that was 3 husbands and 1 boss. We've been together over 50 years. And she came with me from Boston to Florida and finally New Orleans. But after residency, I went to the University of Florida, and Maya and I were married, and she was, poor thing, an ophthalmic nurse trained in Finland who was coming over for 1 year of postgraduate study. But again, you know, these women are incredible. She came with me, she set up my clinics, set up the training program, learned to fit as we were developing many new kinds of contact lenses. And in fact, it was the only place in the world that had lenses for people that really had problems. And Omar Marriott used to fly in, and he called her Pussycat. And at any rate, when I went to the University of Florida, I took Maya with me, Emily, my chemical engineer, a couple of guys who had good residencies elsewhere, but decided it would be more fun and they'd learn more to work with me. And the whole troop went down to the University of Florida. Had no clinic, no patients, no accredited residency. But it all worked out okay. And while there, I thought I'd just tell you, first of all, I was, in addition to doing surgery, and training a large number of ophthalmologists. Most of the professors in Japan and the corneal surgeons. I'm still on the Chinese the graduate faculty of the Chinese University of Hong Kong, because I trained their chief and worked in Hong Kong and did some surgery that was broadcast all over China. And I had weird cases. For example, there was this cabinet minister in Rajiv Gandhi's cabinet in India. He was head of the Hindus, basically, and he was chief minister around Delhi, the state of Haryana. And he developed an infection of the eye, which was resistant to everything. And this infection had eaten up most of the front of his eye. And they got good docs in India, but they didn't want to touch this thing. And the NIH ended up referring him to me, and I fixed him. But it was interesting. He came with a bodyguard, and the bodyguard picked up two guys who had come from India to assassinate him, and they were going to go on and assassinate the president of India, who was coming 2 weeks later. And for 3 days, we had people with machine guns walking around my eye center to protect this guy. And the State Department said that they wished he would have his post-op visits in the United States. So I lectured in Seoul, Korea, and he flew over for his first visit. And then when I was working in Saudi Arabia, he flew to Saudi Arabia, and I took out his sutures. And it was, you know, that kind of life. And then he arranged for us to go on this incredible tour of India, where Maya and one of my sons and I, he put a plane and the minister of protocol on our, and we stayed in Maharaja's palaces, and we had the chief guide of the Taj Mahal give us our private tour. And it was, you know, quite an incredible kind of thing. And I was also, for example, we had someone with glaucoma. I developed new stuff, and it's harder than it looks. For example, I developed the first antiviral. Well, this drug, the first drug I developed, was not very soluble, so you had to treat animals both during the day and at night. And can you imagine, not only I, but Emily, my chemical engineer, and another resident volunteered. The only air-conditioned room in Boston in the summer was our stinky little animal room. They slept on an aluminum cot in the animal room and worked up every 2 hours. No extra pay, no reward, just the idea of this crazy first-year resident with no knowledge that it would work, but they all volunteered to do that. Can you imagine that happening in this day and age? Well, it did work, and I developed some additional drugs, but developing stuff is harder than it seems. For example, when I got to Florida, a lot of people had fungus infections, and I found that a company in Holland had this stuff that they put in cheese to keep it from getting moldy. And so I got some of this and turned it into a drug, and it became the first drug and is still the best treatment for fungus infection of the eye. But there aren't very many, and no company would make any money off this. So my lab provided this drug to people all over the world who needed it at no charge. And I couldn't keep doing that, but the FDA saw the papers, and it was so effective. It's the only time the FDA has ever taken a drug without a company that wanted to make it and approved it. So all a company had to go in was take it over. I developed the ways to keep corneal tissue. In the old days, people would donate an eye and you keep it in a test tube. But I had to take it off and put it in a media that would nourish it and keep it healthy. And you could schedule surgery for the first time, and it was a revolution. But imagine the politics to try and get every single eye bank in the country to change everything they were doing and hire special technicians and get sterilized equipment and special microscopes and all that stuff. We have someone with glaucoma. Merck hired me as a consultant, and they had a drug that they were using for high blood pressure. And I thought this would treat glaucoma, which is a terrible blinding disease, and there were no good drugs to treat it. And I asked them I thought that this drug that they were using for high blood pressure would work, and asked them to let me try it, and they said no. The market just wasn't big enough for Merck. Well, it turned out that the president of Merck had been my assistant resident when I was an intern. So with my own money, I flew up and talked to him and begged him to let me try this thing for glaucoma. And it turned out to be the first good drug for glaucoma. And Merck made hundreds of millions of dollars off it. And I got to thank you very much.
Oh my word.
One of the other interesting things we developed was the excimer laser. That is the laser to change it so you don't need glasses. And this is a laser that contains argon and fluorine gas. And fluorine gas is deadly poison. But it vaporizes tissue, and we thought we could control this vaporization enough to change the shape of the front of the eye so you wouldn't need glasses anymore. For 6 months we talked to Bausch & Lomb to try and get us a laser, this big monster thing, and they thought it had no future. Finally a company said we could have one, and the university said, "You out of your mind? If fluorine leaks out of this laser, everybody in the building will die. You can't bring that thing in here." So what I did was I got an ultra-wide trailer to put out behind. They let me put the laser there so that if it leaked, only we would die. Well, we did all this animal stuff and changed the laser and improved it, and it really worked. And we were ready to try it on people. And the FDA said, "You're out of your mind. You think we're gonna let you take people with normal eyes who just need glasses and vaporize the front of their eye?" And what we had to do was find a series of people who were blind but had a normal front of the eye and were willing to let us do this to them, to watch it and watch it heal. And we did that. And then finally, we could try it on people. And I remember my first case. He was a 40-year-old guy who wore thick glasses and fixed it, and he said, "Oh, Doc, it's wonderful. Now I can date 20-year-old girls." I thought, the culmination of my life. He can date 20-year-old girls. But we've been sort of everywhere, Maya and I, and we've always taken time for some extra vacation. For example, on the way to lecture in Australia, we stopped in Bora Bora and had an incredible romantic vacation there. When I was a consultant to the government in Singapore, it's an interesting problem. Too many of the young men were nearsighted, and they couldn't find enough pilots to fly their airplanes. So they asked me if they could use refractive surgery, this laser we developed, to change it and get some pilots for their Air Force. And I said, yeah. But in the meantime, we took a vacation at a beautiful resort in Phuket and, kind of enjoyed life with all of the rest of this stuff. And also, often when we traveled, we'd take a kid. And one kid would go to Japan, and another India, and another England. And, it was kind of a great life. We went, I started off at the University of Florida, and as I said, I became dean. But I had missed the faculty meeting, and that's how I got elected dean, but I didn't like it. Well, at any rate, we went from Gainesville, Florida, to New Orleans, the University of Florida. And the Lions gave us $20 million to make a state-of-the-art eye center. And I'd done some work in Saudi Arabia, and the Crown Prince gave me $1 million to set up a retina research chair, the only thing he's done outside of Saudi Arabia for a Jewish ophthalmologist in New Orleans. And when I set up my department in Gainesville, I decided I was going to have a world-famous department. But who's going to come to a young kid in Gainesville, Florida? But fortunately, prejudice cut both ways. I hired the people other people didn't value: women, Hispanics, and Jews. And I had a world-famous department. It was spectacular. But at any rate, and New Orleans is kind of like a third world country. It's a little corrupt and whatnot. But it's nice if you're one of the corruptors. And then we came here. We were at the Ritz for 16 years, I think, and then came here to Plymouth Harbor. And Sarasota's wonderful, and we think Plymouth Harbor's wonderful.
Does anybody have any questions for Dr. Kaufman? You know a question or two, right? Come on. Bill? Oh,
Yeah.
I have one. If your mother had not said, or dad had not said for you to be a doctor, I know you've done all this. Is there anything else you ever entertained that you could do, or?
Oh, yeah.
Yeah.
My dad was a doctor, and he was the last of the ones, I think, that used to make house calls. And he'd run up and down till 9 o'clock at night to people's apartment, making house calls and taking care of his family. And my mother thought, you gotta be insane to do that. College, medical school, an internship, residency, and work like that. And my mother decided I ought to have a profession where I didn't have to go through all that nonsense and could still make a good living and be respected. And mother thought I ought to be a plumber. And she found someone in the plumbers union in Brooklyn that she could bribe to get me into the union, sort of a father thing. And for 2 summers, I worked as a plumber's apprentice down in the mud under the houses, and didn't do me any harm. But she was terribly disappointed when I decided to go to Princeton.
I've had LASIK, my wife's had LASIK. What do you think when you see it's become so popular and omnipresent?
Yeah.
How do you feel about that?
I think it's wonderful. It's like cataract extraction. When I was starting off, cataract extraction was a big deal, and you were in the hospital for days and you had to lie still. Now it's an outpatient procedure. You can't imagine what we went through to develop the laser, but now it's so good and there are so few complications. It's quite wonderful. Yeah. And the other stuff worked out good. The eye banks, so I used the stuff we developed. The glaucoma drugs work. I mean, it's nice when you see something work. Yes.
Kim? Okay.
Well, first I'd like to thank you for risking your life for us. That's great. I used to be a drug rep years ago, and I was just curious, a drug that didn't last very long, What was the half-life on it?
Of what?
You said, I don't remember the name of it.
Oh, the first drug?
The one that you said you had to give often?
Yeah. See, it was not practical because it was relatively inside. It was a breakthrough. And in fact, when I did this, I brought it to a big drug company because I knew they had an active antiviral program. They had closed 2 weeks earlier because their scientists and their board of directors had decided that treating viruses was impossible. Viruses took over the cell, and you couldn't kill the virus without killing the cell. And so this sort of reinvigorated the whole field. Now, shortly thereafter, I developed a much better drug that you didn't have to give off of, you know.
Oh,
But
nice.
that was just the first one.
Yeah, okay, thank you.
In fact, when I was a resident all this time, and the doctors on the staff started sending me their herpes patients so that I could treat them and study them. And the nurses called it herpes virus.
Wow.
Uh,
Go ahead.
Thank you.
We know you can keep talking.
No, that's it.
Yeah. No, any questions? No, but thank you so much. So many